So our next speaker is going to be Judith Golz. Judy is an RN who's been in the business for 30 years and also a patient herself, and she's going to talk today about the multidisciplinary teams for treating neuroendocrine tumors.
Good morning, zebras. I just want to say that I thought what Mary Ann said this morning and seeing all the hands raised was really, really encouraging. I myself am 17 years, and I also want to thank Mary Ann and Bob from taking a small support group into this, huge NCAN and so on. So it's very, very encouraging. I've also seen so much in 17 years. So a lot of what I have to say may pertain to some of the newly diagnosed, but I hope that it helps everybody. So I hope by now that you all realize you're part of a great community. I've met some of the greatest people with this disease, and I sometimes wonder if maybe only special people get this. I'd like to think that. When you're first diagnosed with cancer, it's very overwhelming and it's scary, and you feel very powerless. And I'm here to tell you that there's a lot of things that you do have power over. And one of the main things that you have power over is the way you are treated and the journey that you will go through. So one of the things that's very, very important is that you have the power to make your own decisions of who treats you, what treatments you get, and what medications to take. You obviously already know that. By coming here, you're already seeking that information and gathering that information, and also seeing all the specialists and hearing what's out there. So that's very, very important. One of the most important things is that there is a need to really incorporate multidisciplines of care into your treatment plan. So the first thing is always to seek out a specialist. And many of us can't travel to see one of the neuroendocrine specialists, but there's lots of ways to get to them. One is coming to the conference. Another is maybe having your records sent so they can review some of your records for a consultation. And the other way is a lot of these doctors will answer questions in email or on some of the websites. So there are ways to access that. And as the previous doctor said, there's information for the doctors themselves, your local doctors. There's medical information for them with the guidelines. I'm sorry, I have to keep putting my glasses back on. I always tell people that if you were a manager of a company, you would, and you were given a project, you would have to hire qualified staff to help you through that project. And I approach my care like that. You are the project. And it's very important that you put a team of doctors together to monitor you and maintain you. So one of the most important things after the specialist is to set up a group of doctors that you can periodically see and keep maintenance on, okay? So we all know what an oncologist is, and your oncologist is a cancer specialist, someone that will work with you to do your testing, do your blood work, and also prescribe the medication if you do go on sandostatin or lanreotide or any other type of chemotherapy. The next is a cardiologist. You're going to learn a lot of things here at the conference, and for those that are new, it's very important that we see a cardiologist at least once a year. It's very important to have an echocardiogram. Now, a lot of us get EKGs, which is basically a single strip monitoring the heart, but an echocardiogram involves a sonogram as well, and it's very important to really monitor the heart when you have neuroendocrine tumors, because high levels of serotonin and other hormones can destroy the heart valves. Nowadays, we don't have to worry about it as much, but it's very important to just get a baseline after you're first diagnosed and to monitor that. It's also important to tell your cardiologist if you're having and experiencing anything like heart palpitations or, chest pain or anything like that as well. The other doctor that's very important to see is a gastroenterologist. And a lot of us were diagnosed by a gastroenterologist, particularly the mid-gut and foregut patients, because a lot of us started with symptoms where we had abdominal pain or GI bleeding, and or just almost like IBM symptoms. So we would go to a gastroenterologist, and that's usually where our journey began in trying to get our diagnosis. But it's important to stay with the gastroenterologist. It's important for us to have our colonoscopies or our endoscopies, and it's also important for them to check the anastomosis if you've had a small bowel procedure and things like that. Once a year is usually generally good enough to see, but it's also, a good doctor to have on your team. One of the most important doctors that I think is important to have on your team is an endocrinologist. And an endocrinologist is a hormone doctor. Many of us experience other hormone issues. There's a lot of co-diagnosis with neuroendocrine disease. Some of us even have what they call general neuroendocrine disease. I, for example, have hypothyroidism. I've had my parathyroid removed. I have adrenal issues. So I had infertility issues. There's a lot of multiple other endocrine or hormone issues that we can have. So getting a good endocrinologist on the team, I think, is also essential. And they can help monitor some of the other hormones that you could be dealing with. And that leads into gynecology and urologist for men, because as women, we should just all be getting our annual pap smears and mammographies. And as men, it's very important to get your PSA, which is the monitoring of your prostate. Carcinoid and neuroendocrine can occur in those areas of the body, and it's important to monitor those things as well. Another one is a dermatologist, and this is another doctor that some of us have sought out initially because of the flushing. We thought it was rosacea. Many of us were misdiagnosed with rosacea prior to official diagnosis. And so it's important to, seek out some of the dermatologists, for skin care. Some of us suffer from hives because of the histamine release. So it's important to, incorporate a dermatologist. I also think it's important, we all know skin cancer is on the rise, so I think it's important to just do a body check once a year and, just keep yourself, monitored for that. This sounds like a lot of doctors. And it sounds like a lot of maintenance, and it is. But I always kind of look at it like, we get oil changes and we get our hair done and things like that. And again, remembering that we're the project, I think it's so important to incorporate and monitor yourself, because the whole idea is to live with this disease, and many of us are doing that. And preventive medicine, I also think, is key. I believe in that as a nurse, and I think that it's better to find something early or small, and deal with it. Our bodies give us a lot of signs, and it's worth checking out. And not everything that happens to you is neuroendocrine related. We get colds, we get hangnails, we get other things. But, we still have to maintain ourselves as human beings as well. I think it's important to remember that nobody cares about you as much as you. And also to remember that you're also part of that team. So it's very important that you're communicating to your doctors as well. Now, a lot of doctors that you go to may not know a lot about neuroendocrine disease. So you have two choices. You can interview lots of doctors. I probably interviewed about 5 or 6 gynecologists before I found the right gynecologist. Because if you go to somebody and they're very narrow-minded, or, it's okay if they don't know, but if they're not open to learning about it, then they're not for you. If they're not receptive to you being a member of that health team, because you really have that power. You have a right to all your records. You have a right to discuss your care. Nobody can dictate to you what you have to do. It's your job to gather that information, but it's also your job to communicate to your doctors. So don't be afraid to interview doctors, and don't be afraid to ask a lot of questions. And you want to feel very comfortable with whoever you see, that, that they have your best interest. It's very, very exciting to see how many of us are living and surviving with this disease. And I just want to remind you that, although we can't help what happened to us, we can't help that we got cancer, and we can't help that, some of it, takes its own course, but we can take back some of that power and that control of who and where and how we decide our journey should go. Thank you very much.